Hey everybody, how you doing? Bill Colarulo from Colarulo. I am very honored to have our guest on tonight. It is Alisa King, a registered nurse at a local hospital, and she is working in the front lines in a designated COVID-19 unit. Alisa, thank you so much for making time to come on tonight.
Thank you guys for having me.
And you're probably going to hear me say this a million times, but again, thank you for everything you are doing. I cannot imagine what you guys are going through. You've been a nurse for almost 10 years. Have you ever been through anything similar to this before?
No, not at all.
And can you tell us a little bit about, what you guys are dealing with there on the front lines?
It is definitely eye-opening. Everything that is seen on TV and shown on social media, it is true, it is real. A lot of people that aren't in the healthcare world, they think that it's almost fake in a sense, but let me tell you, it is not. It is real.
Wow. And is there anything that the public can do, the non-medical professionals, that we can do to try to help you guys out a little bit?
Listen and stay inside, please. We need all the beds we have available. We need them for the COVID patients. They say it hasn't even peaked yet. I'm praying to God that it doesn't, it's not as bad as they say that it's going to be. But the best thing that everyone can really do is social distancing and staying inside.
We were talking about, what we can do, non-medical professionals can do to help. And you said social distancing and listening to the media about what things to do. What about face masks? And I've been seeing a lot of different things about, people, non-medical professionals hoarding masks. I mean, can you touch on that at all?
So the main thing is the PPE that we need. There is a national shortage everywhere, and it is real. Please do not hoard any masks, any respirators, anything like that. Please, you do not need them right now. We do. If anybody has them, please donate them to a local hospital because they will be used. They are very, very, very crucial to us.
And please, everybody out there, listen. I mean, obviously follow the recommendations of the CDC and your local governments on this, but please, our medical professionals need it. They're there in the front lines battling this head on every single day. So we want to make sure we protect them because God forbid they all get sick. Then what are we going to do? I know you're a mom as well, so your kids aren't in school, they're not in daycare. I mean, how are you handling it? I always think about these nurses and doctors who are unable to stay home. I mean, how are you handling managing both your job and fighting for your community, but also taking care of your family?
Well, I'm thankful that my daughter's in kindergarten, so her homeschooling isn't as severe, I guess, if she was, in fourth grade or fifth grade. So I'm lucky in that aspect, but it's just hard for me overall. With them working on the unit I haven't kissed my kids in 3+ weeks. I try not to get too close to their faces. I take as much precaution as I can because I never want to bring this home to them.
Well, I didn't even think about that, about just showing your family some affection.
Yeah.
And one of the positives, I guess, that has come from this is I've seen just an outpouring on social media with regard to thanking our medical professionals. We don't have our professional sports going right now, so there's no pro athletes. There's really nothing else that people are putting their time and energy into. And everyone seems to now, our true heroes are you guys. What does that mean to you to see all of this support that you guys are getting from, your local communities and even nationally on social media?
It makes us feel really appreciated and loved. It gives us a purpose too when we go into work. We're feeling accomplished of what we're doing right now. It's hard. Everybody's work has their own little family unit. The people that I work with, I love them all, and we're just our own little family. We're in it together. We're all in this together. So we really appreciate the outpour of love from everybody right now. It's really, really nice.
Well, Alisa, again, thank you so much for everything you're doing. I don't want to take up any more of your time. You probably just got home. I want you to spend that time with your family. But thank you. Hopefully we'll get through this. If there's anything that I can do or that we can do, you please let us know. And, keep fighting the fight, and hopefully we'll come out of this stronger.
Thank you. Thank you so much for having me.
Talk to you soon.